allergist, immunologist and asthma super specialist, when I evaluate patients who come to me with this question, whether air pollution is the reason why they are having a cough or difficulty breathing or difficulty in exercising or breathlessness or any of these things, clearly my goal is not to evaluate only impact of air pollution. The first thing we do is we test something called a pulmonary function test, also called a lung function test or a spirometry for such individuals, and figure out where their lung capacities are compared to the standards for their peers, their age and height related peers of those individuals. Besides this, we also look at a very unique marker called exhale nitric oxide, which is a simple test done on your breath, which can tell us whether the impact of air pollution causing inflammation in the airways is present or not. With these two tests, we get a direct answer whether is clearly a person has asthma, has COPD or any other lung conditions, whether that is impacting their health. And besides that, we also then assess, because it's also to be understood that allergies combined with air pollution, both indoor and outdoor air pollution, has a much greater impact on an individual than others. So a very careful assessment of their allergies is done through skin testing, through blood testing. There are different modalities which vary from person to person. And as an allergy super specialist, we decide what is best for that person, what is safest for that person. And when we holistically evaluate their exposures, their home environment, their risk factors, their genetics, their family history, when we put all of these things together, we are much better able to recommend them what kind of prevention measures they can use in their home, what kind of diet and lifestyle they can follow that can be individualized and customized. We can also give them specific medications that may be helpful to reduce the impact of indoor or outdoor air pollution on their lungs and their body in general. Certainly those who have asthma, COPD, there are certain inhalers that can be given to them which are anti-inflammatory. Recommendation of changes that can be made in the home environment that reduces the impact of allergies or air pollution are very specifically done in our practices, whether it is with children, teenagers or adults. And when you take such a holistic approach where all aspects of that human being, where they are going, where they are staying, where they are studying or working, what their exposures are, what can be done in each of these environments to reduce their risk, the end result is generally very, very positive and good. I have even had teams visit people's homes to assess the risk factors inside the house, besides what is going on obviously outside, and guiding them about it. And this kind of an approach has made a very big difference to our patients who have allergies, who have asthma, who have COPD, who have ILD, who have many other chronic diseases, as I said, in improving their quality of life. Because remember, that's our ultimate goal, is an improved quality of life, because we do realize that air pollution can cut down a person's lifespan by anywhere from 5 to 10 years in India. And so overall, it's a very, very big thing to holistically and completely evaluate an individual or a family and then give them the recommendations that are practical, that are doable, and that can make a difference to their health.